This podcast is being brought to you by Trinity College Dublin. For further information, please visit our website itunes.tcd.ie.
Okay, good afternoon, everybody. I'd like to welcome you all here this afternoon to today's seminar, which is part of the Social Policy and Ageing Research Centre and the Living with Dementia Programme's seminar series. My name is Research Fellow in the Social Policy and Ageing Research Centre, which operates under the directorship of Dr. Ferpy Timonen. And both Spark and the Living with Dementia Programme, which operates under Suzanne Cahill, who I don't think is here yet, are both based in the School of Social Work and Social Policy in Trinity and aim to conduct research into ageing and dementia to help ensure that Ireland becomes a better place in which to grow old, and we look at services and planning for older people. And one of the areas that has undergone a lot of change in recent years is the area of residential care for older people, not least with the introduction of a new regulatory regime under the Social Services Inspectorate Division within HICWA. The system is very much still bedding down, and people are trying to understand their own role within the process and their relationship between HICWA and providers. And I think really to the best of my knowledge, HICWA has been particularly instrumental in trying to forge good relationships with good providers. But it's always really useful to understand other countries' experiences of an inspectorate system. So it's my great pleasure to introduce Sheila Furness, Senior Lecturer in Social Work at the University of Bradford, to talk to us about the contribution of inspection to the quality of care homes in England. Sheila has worked as a social work lecturer in the UK for many years, and her main research interests are on the impact of religion and belief on practice, social work practice, elder abuse, and ways to promote good practice in care homes. And because I guess Sheila worked as an inspector before, she has lots of experience, personal experience in the area. And just to say a couple of things before we start, Spark is hosting a conference in November. There's some flyers in your pack, and some of the topics are going to be related to the area of residential care. So it would be great if all of you could have a look at your flyers and put them up in your place of work and advertise our great conference. And also just to say that I know Sheila is very anxious that we have lots of time for discussion at the end of the seminar, which I think might be particularly useful for all of us here as we learn together. So please don't hesitate to jot down any comments or questions that you might have, so we can discuss it at the end. So I'll hand over to Sheila now. Thank you very much.
Thank you. Okay, good afternoon. I do feel very honoured actually to come to Dublin, because obviously I'm aware that this institute is a very renowned sort of place of learning, and I think it's fantastic that there's so many people here today. I understand that you cover a cross-section of interest, and just for my part really, and perhaps for others, could I just have a show of hands, those are from HICWA? Okay, and what about from the care home sector, managers, staff? Okay, academics, advocacy groups, and is there anyone forgotten? Pardon? Okay, great. So, I think it's very, very interesting that obviously this area is of interest to you, and obviously there's a lot of changes that have been taking place in England. So I'm hoping that my presentation will actually look at how the regulatory system has developed and shaped in England, and maybe some of the comparisons that you'll be able to make to here in Ireland. As Kira said, I am a social work lecturer and researcher at the University of Bradford, and as she said, my area of interest is religion and belief in social work. So some of you might be interested, just to plug for a book that I've written with my colleague, which is about religion, belief and social work. And obviously I think there's some things of interest which can be transferred to care homes as well, in terms of caring for the belief systems of people living in care homes. So the overview of the presentation, I'm going to look at the English legislation going back as far as 1984 to present, and cover some of the key changes that have affected care home regulation inspection over that time. I'm going to report on a study that I conducted in 2004 that sought the views of managers of care homes for older people about the inspection process at that time. I'm also going to look at the role of inspectors in light of the findings and published literature. I hope to conclude by raising some questions about the current direction of regulation and whether it can meet its claim to improve the quality of care standards. So, since 1984, obviously care home owners and managers and inspection staff have had to respond to substantial reforms of the system of regulation. I think, interestingly, the successive governments have not really changed the systems based on research as such, but more on looking at the impact of regulation as part of a wider policy agenda to regulate public and privatised services. In terms of the Registered Homes Act, at that time, local authorities managed their own in-house provision of residential care, and there were separate arrangements for the registration of private and voluntary residential homes. Nursing homes at that time came under the jurisdiction of the Health Authority. Also at that time, there were no nationally agreed standards, and this led to local authorities determining their own registration requirements. And although local authorities tended to adopt some of the recommendations in then the Good Practice Guidance of Home Life, this did lead to differences both at local and national level. So as an example, Bradford, where the authority that I used to work, demanded different staffing levels, building standards to neighbouring authorities. So this meant homeowners that with homes in different authorities had to meet different requirements at that time. Also, local authority provision was treated very differently in that they were not inspected in the same way or had to meet the same standards as private and voluntary residential homes. In Bradford, the Care Homes Association, which I think you have a similar body here in Dublin, was a membership body that actually represented the local residential care homes and set up meetings with then the local authority residential and daycare managers to discuss the new requirements. And at that time they were able to negotiate some compromises, such as in respect of the ratio of single and shared bedrooms, and agreed timescales for implementation of the standards by existing homes. I remember as an inspection officer during that time visiting many, often homes were in large Victorian adapted properties, and there could be 6 to 8 residents sharing one bedroom. And I was interested to read Kira's account of some of the discussions that the consultation members of the Irish Working Group on Irish Standards had, particularly about the change in physical standards in terms of bedrooms, the requirements single to double and shared bedroom space. And I think again at that time I remember homeowners really sort of challenging the view about reducing the number of beds, and a similar argument that people did like to share in those sort of accommodation. But I think obviously when you're faced with considerable expense to update the facilities as well as facing a loss of income by reducing numbers, I think that was one of the shift that homeowners felt it had to be sort of challenged, thinking about the viability of the business at that time. But now, obviously in 2010, it has become more accepted that there are going to be obviously more single bedrooms and that people don't actually want to share and sleep with other people through the night. Also under the 1984 Act, local authorities then managed their own in-house provision of residential care, and there were separate arrangements for the registration of private and voluntary homes. Again in Bradford, one of the big changes was that local councillors determine the number of inspection visits to homes. So you might be surprised to hear that we used to inspect 4 times a year, which might seem excessive, but what it did do was that we did actually build up, I feel, quite good relationships on the whole with homeowners, because we became to know not only staff, where it was a stable staff team, but also many of the residents that were living in those homes. But during the period, such as 1984, particularly to 1990, we found that many homes did change owners and some homes closed, as the local authority also did use the powers to deregister owners and managers where there were serious concerns about the health and well-being of residents. And obviously as an inspector, that you're not going to be there 24 hours a day, but you did have to rely on people coming forward and expressing concerns. So that might be staff or ex-staff, it might be residents or relatives or other professionals going into the home. And I don't think that has changed still today. I think there's a need obviously about safeguarding, but also people being able to give feedback, positive feedback, as well as negative comments about the standards in homes. But I think what I saw was that our managers were prepared actually to take what was seen as tough action against failing homes, but I think there was also an attempt to try and work with homes, and we put in, for example, free training. So at that time, sort of early on in the mid-80s, care homes didn't actually have care plans for residents. Reporting was very minimal, and so it was an attempt to actually look at what is the plan to try and look at an individual's needs and to provide person-centred care, and for staff to be able to understand the particular needs of that resident. I think this period also saw this massive growth of increase in the numbers, particularly of private and in some cases voluntary care homes. And again, I think this was in due partly to a change in policy that encouraged the private provision of welfare, as well as payment by the state at that time of care home fees. So the next sort of key piece of legislation was actually the National Health Service and Community Care Act 1990. And because there had been a number of, I think quite rightly, serious criticisms about the 1984 Act, and also it became apparent that there were a number of abusive practices that were highlighted across a range of institutions, which I think has been in the last few years the same in Dublin, that I think the government needed to sort of look at tackling some of the sort of scale of this problem. And what was established were local authority arm's length registration inspection units, whose remit was really to continue and register and inspect private and voluntary residential homes, but also to look at local authority provision. And at that time, some registration inspection units teamed up with health authorities, so there might be some joint inspection teams that actually inspected residential care homes as well as nursing care. Some parts of the country that remained separate, but it was an option to do that. And we also saw in England we had duly registered homes, so that you might have homes where they actually had facilities, so people who needed residential accommodation, and as their needs changed, that they were able to, this is a recorder, as their needs changed, they then actually were able to move across into the nursing home section. But I think these new arrangements were still problematic, as inspectors were still employed by the local authority and ostensibly had to answer to the Director of Social Services. And therefore, I think critics, homeowners in the private voluntary sector, I think argued that inspectors were still not really independent. And I think that was a fair criticism. That homeowners, I think, demanded that local authority homes should be inspected in similar ways and also to meet the same standards as expected of the private and voluntary residential sector. So building standards criteria were later applied, but this meant that I think in many parts of England local authorities had to close homes as they didn't really have the funding to be able to update and refurbish the standard of the buildings. And I think this period signalled maybe a lighter touch in terms of how local authority run homes were now given timescales in a similar way to what private and voluntary homes had been given in the 80s in order to bring them up to meet the registration requirements. And I think there was also at that time an attempt to sort of standardise the inspection regimes and so to offer a model which would aid inspectors to comment more on the quality of life of those living in homes. And some of you might be aware of a document called Homes That Are Living In, which I thought was, a good guidance document which could be used by both homeowners and managers as well as inspection staff to be able to focus on key principles of good care, such as things like looking at privacy, dignity, independence, choice, rights and fulfilment. And so there was a shift from maybe not concentrating as much on looking at the record-keeping aspects of inspection, which I think there were criticisms that when inspections took place, there might be half a day, a full day, just looking at the record-keeping aspects and making sure that they were in place, or just looking at the building standards and checking that carpets were not worn and that good quality furnishings. But to say, well, let's really look at the quality of life for people actually living in these homes. And so I think homeowners also, I'd say managers, with those guidance were becoming more looking at self-audit to think, well, do my staff knock on doors before going in bedroom doors? What about encouraging people to be more involved in activities, staff encouraging people to choose the clothes that they were going to wear, and so on. But I think also that signalled the start of more sort of total quality management systems, and I think it saw the start of a raft of measures that were designed to monitor all aspects of home life. And I think again there can be some positive aspects of that, but also there can be some negative aspects which we'll go on to look at. So I took up my post in 1986, so it's obviously quite a long time ago now. But prior to that, there was just one inspection officer that used to visit all the private and voluntary homes. And I remember just as I took over with 3 other colleagues, that she was visiting a home and found a resident tied to a chair with a scarf. And then obviously this was challenged, and the owner-manager, who was a registered nurse, was told the inspector that she was doing it for the resident's safety. And I think then at that time the owner wasn't prepared really to admit that that was an abusive practice. And I think things have changed considerably since the 80s, where we've got organisations such as Counsel and Care that look at things about misuse of medication and restraint. But I think what it points out is that it's very unlikely that when an inspector visits there's going to be something as extreme. But there might be other examples where us inspectors can actually comment on, I think, both good care, and I think it's important to remember that many homes do provide some excellent care, but unfortunately there's the other end of the spectrum where some homes don't provide that adequate care. And just again as one example, remember I was inspecting a care home and sat in the lounge with the residents, and a care assistant walked in and hoisted the resident over her shoulder in sort of like a fireman's lift to take the resident to the toilet. And I was just shocked. I couldn't believe that anybody could actually come in, and I've never seen anything since then. But again, you know, I suppose it's the unexpected that you actually, you know, amazed by, and actually can then challenge. Another, I suppose, change at that time was the requirement for homeowners to write pre-inspection questionnaires. So rather than the inspector going in and actually looking at all the records, there was an attempt to actually think, well, can we actually use the inspector's time in a more, you know, appropriate way to spend time with the residents, with the staff, observing routines rather than checking records. So I think, again, we've seen this change where now more information is required from home managers really prior to inspection visits. And again, inspection regimes changed so that rather than just going out and checking records, we had a system that we'd go in and actually identify a resident and track their progress. So we'd look at, you know, admission records, we'd look at care plans, we'd look at reviews, we'd spend time with the resident, with families, with staff, to try to just get a better feel about the quality of life, how that person, you know, was encouraged to be independent and spend the time in the home. And I think that was important that there was that change. There were also theme visits which focused on, you know, activities, routines and so on. So trying to bring it a bit more up to date, because I realise I'm sort of giving you sort of a historical journey through this sort of shift in inspection regimes, but hopefully you might be making some links with that to how the system is here. So from the 1st of April 2002, the old system of residential and nursing homes under the Registered Homes Act ceased, and a new body, the National Care Standards Commission, was set up in England, and it had a wider remit. So basically it wasn't just to focus on residential homes, but actually looked at children's homes, a number of other agencies, clinics and day centres. Many former inspectors actually transferred across to that new regulatory body, and where previously there'd been perhaps 150 local authorities and 100 health authorities in England, obviously you can, as I said before, that we had a patchwork of standards. So it was an attempt to try and think, well, can we have some common standards now, nationally recognised standards, which would be fit for purpose across the country. Because we'd inherited a system whereby there'd been a reluctance to actually identify what staffing levels should be, what room sizes there should be, and so on. So this was an attempt to say, well, can we set some agreed standards, which I think you've been going through that process as well. And this new body, the National Care Standards Commission, then was independent. It was to be a public body accountable to the Secretary of State and solely responsible for the regulation of health and social care services that had previously been regulated by local councils and health authorities. And for the first time then there were going to be national minimum standards. So whereas the care homes regulations that accompany the legislation are mandatory, the Commission obviously had to take in the national minimum standards and also consider perhaps other relevant factors. So I think this also signalled a shift to, rather than concentrate on processes, to more of an attempt to look at the outcomes. What did this actually mean for the people living in the home? And I think that's still reflected in the attempts with the new inspection. So regulators really had to look for evidence of each standard through discussion with residents, the families and friends, staff and managers, and others. So it's very much observation of daily life, as well as scrutiny of some of the policies, procedures and records. And I think we can't underestimate, obviously, opportunities to actually speak to people using the service to get some idea of views. And I remember speaking again to one resident who said to me, I thought there was somebody important visiting today because there were some flowers and fruit on the tables. I'm not saying, that doesn't happen every day, but obviously people had made an effort and residents had noticed in that. Okay. So in terms of the Health and Social Care Act then, again, sort of new legislation that was brought out. So we had yet another change. So in terms of then the National Care Standards Commission, under this sort of legislation became known as the Commission for Social Care Inspection. So inspectors, homeowners had within these, quite a short period of time, had to not only come to grips with new legislation, new bodies, and also have to actually carry on inspecting or continuing to provide a good care service. So I think we've also got to think of the impact of that on the care home sector and everyone associated with it, because change, it feels like change has not been allowed to embed itself looking at the standards before we've got yet another sort of system of standards to sort of be able to understand and to be able to implement. So part of this, this new change meant that there were going to be annual quality assurance assessments, and again this sort of self-reporting, and I think we do see that as a common tool again in all areas of provision. So whether it's education, health, this shift to get service providers, even as an academic institute, I'm responsible for a social work programme, whereas I have to report to my regulatory body about the service that I provide. And so there is, I think we see this as a sort of a common strand that is affecting us all. And again, I think there can be some good of that, but I think there can also be some dangers that if we want to look at if the service is actually meeting specified performance indicators, then we've got to look at are the sanctions, such as a reduction in funding, as with local authorities, is this going to actually manipulate or change some of the statistics or reporting? And I think in my view, I think self-reporting can be open to fraud and perhaps is not the most effective way of measuring performance, as questions may be misleading, perhaps open to interpretation. And I think sometimes there are perverse sanctions, such as failure to comply could result in a loss of funding and income, and therefore perhaps doesn't encourage as much open reporting and honesty. And some of you might be aware that the King's Fund have just published a report which is actually looking at quality in healthcare, and they talk about gaming, whereby a recognised way of getting round the sort of reporting system is whereby a conscious effort's made to find ways to achieve the required level of performance against a given measure, or appear to achieve it without actually achieving the changes that have taken place. And again, I'm not sure if you have the target here in accident and emergency, whereby you're supposed to be seen by a triage nurse within a short period of time, and there are penalties if a patient isn't seen within that time. And so what's happened is that I know, when I went to casualty recently, I was seen very early on by, I think they call them in this report, a hello nurse, but yet I still wasn't seen for quite some time afterwards. But the hospital were able to actually indicate that they'd met that particular performance target. So I think we are all human, that we do actually think, well, if this isn't possible to achieve, can we get round it? And I'm sure there may be other examples that you find, that if by being honest, then you have a harsh penalty, then it doesn't actually encourage people to be honest and report some of the problems. So I think there's some worries about if we're moving to more self-assessment reports in that way. Also, what was introduced was some ratings. And I think this was an interesting change because, again, I think homeowners that we used to inspect, many were actually interested in us rating the home. And I think because of challenges to say, well, actually, is it personal? Is it a personal judgment? Is there some bias there? Or is it more objective? I think there's always been a reluctance to actually rate some of the standards. But actually, Seasky actually did ascribe a value to each home and quality. And so that if a home that was actually rated as excellent, then Seasky said the visits would be once every 3 years. Good homes would be inspected once every 2 years. Adequate homes once every year. And poor homes to have at least 2 inspections per year. So you can see that there was a change, a sea change, I think, to risk management. So homes that were judged to be performing well were seen to be able to function, but homes which were not performing, then, and if there were serious concerns, they would be the target of more visits. And I think cynically, I suppose what it is, that as we've seen the inspection teams reducing, then there has to be some way of how can you use the resources to best effect. So I think this fitted in with actually if staffing inspection numbers were actually being reduced, then if it was seen to target the homes which had most concern. But I think there was again a swell of opinion from perhaps supporters of rating claim that it does encourage the public to know which homes are performing well. But I think some of the critics again said, well, what about, things can change very quickly. So I think the regulatory body said, well, there will be other triggers. So if there was a change of management, if there'd been a complaint and so on, that would trigger an inspection visit. But interestingly, the rating system is going to be scrapped. So the new regulation system is actually not going to rate homes. And again, I'm not sure if you've been here thinking about that debate, whether homes should be rated or not. And you might have different views about that. So I've said this new this Act created then firstly the National Care Standards Commission, and now we've been a new body, the Care Quality Commission, was actually introduced in 2009. So you can see we've had a series of regulatory bodies. The names have changed, and I think it's been more to do with having a wider remit of regulatory activities. And obviously with that has come new legislation and new inspection regimes. So the new inspection regime that we're facing in England has not been tried and tested yet. We've got a new registration system that comes into place from October. So all existing care home providers, as well as a whole raft of other providers, particularly health, across the health sectors, are going to be registered. But I think what this Act did see, that what it has brought in place is the regulatory machinery, in my view, for the wide-scale privatisation of health and social care provision in England. I think the policy was instigated by Labour and is now being implemented at a rapid pace by our Conservative and Lib Dem coalition. And I think we're seeing that regulation is costly, and and we're now facing in England a public spending review, and it looks likely we're going to be more cuts in public sector provision. So I think what we're going to see is a greater sort of shift to a whole range of services being dependent to the private sector to provide those services. So we're also going to have, so we had new national minimum standards, which interesting, I was trying to look at the standards that you have here, and some of them are very similar, but now we're going to actually be replaced with 6 outcomes, which are going to be around information and involvement, personalised care, treatment and support, safeguarding and safety, suitability of staffing, quality management and suitability of management. And again, the guidance in itself is not going to be enforceable, but can only be applied in conjunction with other legislation and policies. And the body you're talking about then, there are different strands that we're looking at. So registration is going to be very important, particularly for new providers. And I think perhaps one positive thing would that be that because now it's a national system whereby you've got providers, maybe some of the large corporate providers, whereas could be registered in one part of the country and it wouldn't be known in another. This is an attempt to actually look at, how many different units each provider will have. And if you look on the Care Quality Commission website, it talks about very much sort of new intelligence, whereby there will be judgment frameworks, so that they will be looking at influencing factors such as the standards which I've talked about, and there will be probes or prompts that inspectors can use, which is freely available for homeowners to look at, so that if there is a visit, to be prepared to think on the focus of that inspection. Very much it will be collecting information from different parties, so that if there have been complaints or compliments, that should feed into it. Working very much with the safeguarding boards that each local authority has in place, working with any perhaps residents and relatives groups, so that this will then all of this information will be taken to try and inform the assessment of quality. And then there will be a view that yes, the home is complying, or there might be minor, moderate or major concern about the care standards. So I thought this was perhaps an interesting one to look at. So outcome 1, how people are respecting and involving people in using services. And I think this is going to be a very important way of trying to particularly ask people, are people involved in how the service is planned and run? And I know I was particularly interested in, I think some of you have set up maybe resident councils or friends of care home groups. And I carried out with a colleague, we did a study over a year where we actually set up two groups with obviously the sort of the willingness and consent of the home and the relatives and residents involved. But unfortunately, the groups didn't run after 1 year, and I think that was partly because in one home there was it was a new owner and a new manager who left after 4 months, and so a new manager came in and the homeowner had inherited a number of problems. So I don't think that particular home there was enough stability for it actually to be able to look at what's seen as perhaps an added extra of trying to work with the relatives in that particular home. The other home, I think there were only really 3 people that were directly involved in setting up the group. So it was it turned into more fundraising and I think that's where they saw their remit. So, but I think if you can actually get on board the relatives, and if residents are able to contribute and feel that they have some sort of say in providing the views about the care that's being provided, shaping the activities, then I think that would be a healthy sort of spirit and way to take forward. And maybe you've got some views about that at the end. Maybe some of you have tried it. I'm not saying it's easy to actually, maybe get relatives involved because obviously people are busy. But it may be that if it's done very early on, so as people's relatives are actually moving into the care home, then that's the way forward to actually engage with people very early on and think about what is their role in terms of them maybe being a key carer to actually being able to actually let go, and the home actually be able to take on some of the key caring responsibilities. Okay, I'm not going to say too much about the sort of study that I carried on, but although this was carried out in 2004, I think some of the findings are still quite current today. So it was just a small study whereby in a particular area we sent a letter to 47 registered care homes, and then there were follow-up telephone calls to all of the homes, and from that initial contact we actually had 19 care homes that wanted to participate in the study. All were privately owned. So I didn't carry out the interviews, but somebody who was a retired social worker actually carried out all of the interviews, which were sort of transcribed and recorded. And so there were interviews with the managers who actually identified a resident living in the same home who was willing to be interviewed. And for us it didn't matter, that the manager had selected or asked the resident. It was about trying to find out the views of the managers and the residents. So what I was particularly interested in was about managers' views about the purpose and usefulness of inspection and the influence of inspection on care practices. So again, I think there's very little evidence which has actually looked at, well, what does inspection mean? Does it make any difference? What are the views of people living in the home? Do they know who the inspectors are? Or if you're going in just once a year, do they care? Have they got any sort of relationship with that person? What about the relationship with the managers, and their view of the inspection process? And so it's very much trying to think, well, have they got ideas about how to improve the inspection process? They might do. Have they ever been asked? And I think what was interesting was that managers were very busy, but I think the ones that participated felt that it was the first time they'd actually been asked for their views, that they felt they were also a party to this sort of regulatory machinery and just had to comply. So, I think there was some benefits for them. So thinking about just their views of inspection, I think they're the main one. Remembering it's only quite a small sample of 19, but roughly half then thought it was about checking that residents are well looked after. About a quarter thinking it was about achieving or complying with standards. A similar number making sure the homes run properly. Another sort of quarter about a double check against own audits. And I think that's important. We do register managers as fit people who've got a lot of experience and should be there. They've got the prime responsibility to make sure the home's running properly and should have their own system of tackling any shortfalls. Then obviously reduce things about checking for correct staffing and training. And I think, again, I'm sure Ireland's not dissimilar to England, where homeowners struggle, I'd say, to find good staff because of obviously issues to do with poor wages, poor status, that we have suffered a recruitment crisis. Again, I think that might change with if public sector cuts go ahead. I think the care home sector, they might see, more availability of staff that may wish to work in the sector. So that might be good news for some of you if you're care home managers and staff, but that are looking to recruit. But I think it's still worrying that we still recognise it's generally poor pay. Only a small number saw inspectors as a source of advice, guidance and support. And again, working as an inspector, and again, maybe some of you here who work as compliance officers, you might have seen that as your role at one time, very much to try and give advice and support. And I think that's a real loss of expertise, that as you've got now, people, once you go into a range of homes, you can actually pick up and see, what works in one home. There used to be more of a sharing, I think, of those good practices, but I think that is being undermined and in terms of a compliance and monitoring role. And I think that can also affect inspection staff morale, who see, is their purpose there to actually look at the well-being of the resident, or is it really there just to go in and check, a prescriptive check of standards? And smaller numbers about preventing abuse. And as I've said, it's very unlikely, I think, that inspectors will actually witness that. And I think there's got to be other safeguards in place. And again, managers can't be there 24 hours. They've got to rely on good staff training, supervision, to be able to detect, if things go wrong. Because you might employ a member of staff that is abusive, and so you've got procedures in place to be able to pick that up and respond and deal with that staff member appropriately. Then sort of ask a question about the most useful aspect of inspection. And I thought this, sort of interesting. Again, only 37% about looking at it, feedback from an external agency, which I think is important, that sometimes it can be quite difficult working in a care home environment. And so if a manager can be open to feedback, and I think that's also the crucial thing, that, people have got to be able to feel that, you might get some criticisms, but it's how you respond to that. And if you stifle, feedback, or sit on it, or don't be accepting of it, then it can make people feel reluctant to comment about that. That's a bit of a difference, sort of saying people in this sample thought of it as being about a source of support and guidance, whereas previously they didn't identify that as an aspect of inspection. An audit tool. Only 2 actually said nothing useful and caused unnecessary stress. And I think we can't underestimate, it is stressful, isn't it? Anybody coming in to check that you're doing things properly, whether you're a teacher, on teaching practice, or, my social work students being observed by a social worker as part of their assessed practice. It can be quite stressful. And I don't know if we can lessen that or need to. And then very smaller numbers thinking about resident reassurance, feedback, and only 1 thinking all of inspection useful there. Okay. And I think sort of a message that came out of it was, I think most of them, the 19 were saying, well, actually, the regulation should be about if a home's not meeting those standards, then something should be done. And I suppose that's what we're seeing now, that, will there be greater sort of sanctions if people are not complying, and how that's going to work. And a dissatisfaction was really this sort of increased demands for more documentation that interfered with contact time with residents and carrying out other responsibilities. And I think we're all suffering from that, aren't we? With IT now, even though there might be easier systems, it can feel, social workers are saying that they don't have enough time to go out and visit their service users. care home staff filling in the documentation and care plans. They don't have as much time to spend carrying out the caring responsibilities. And I think that's a real worry. So I just wanted to sort of talk about, just to raise some questions to sort of finally end this sort of section before you might have some questions. But you know, as an inspector, I felt quite passionate about, you know, trying to actually ensure that people have got a good sort of life quality of care. And I'm sure if you ask managers, homeowners, they would say the same thing. But often we can appear to be on different sides. You know, we've got the inspector and the inspected. And can we actually feel that they're actually working together? Or are these systems of regulation going to keep us further apart in that way? I think we've got to also think that there is a current trend towards reducing the operational costs of regulation, as we've seen that these bodies are increasing in sort of their capacity, but in terms of the regulatory remit, the services that we're now seeing in England, we've got private hospitals that are going to need to be registered and inspected. We've got treatment centres that are going to be a lot of healthcare provision, which previously came under the NHS, are going to be private. And I don't know if it's, I suppose because I feel that there should be a service that actually is there for everyone. I think there's a worry, if you think politically, that if we don't have services which are not for profit, you know, people that are actually perhaps minority groups, which so might not be seen as profitable, who is going to provide care for that group? And I don't think this is taken into account in terms of the direction that we're going into in terms of this whole-scale privatisation. And I suppose if we've got this sort of wider remit and we've got inspectors, compliance officers that are going to be stretched, what's really going to be the consequences of this? Is it just going to be a tokenistic registration without any teeth? Will they actually be able to actually impose sanctions on those underperforming, maybe corporate providers? I forgot to give you a statistic, but when you think of the money that the companies, I've got a statistic here, just let me look. So if we think of now, residential care is a commodity, that in 2005, 20% of the market, so we're talking about 5 years ago, 50,000 people lived in care homes owned by the 10 biggest independent providers. That same year, local authorities in England spent an estimated £3 billion per annum on residential provision, most paid to profit-making providers. And I think the projected growth in the market with an increasing ageing population and a guarantee that government or agencies would pay the bills will attract, or did attract, more private equity companies into this arena. So if we know, obviously, care is a commodity, but what about people's rights if that, as we've seen with the banking crisis, if then equity firms are not able to continue, you know, that tenure but decide to sell off the shares in that company, what does that say about the people that are living in those homes? So I think those are questions that are hard. You know, we can see some of you might, I don't know, some of you might work for some of the large corporate bodies and think they do provide training, they do provide, you know, the resources and support. But if it is market driven, are the consequences of if that company no longer wants to operate within that particular commodity? And unfortunately, I think where we're going does point to perhaps a greater monitoring, policing approach by new super regulators. So far we've seen, I think, compliance has tended to concentrate on perhaps punishment, sanctions to address any shortfalls, or a greater reliance on the commissioners, which haven't really looked at, but in terms of then local authority commissioners who then have the responsibility to investigate any complaints, or if they feel that they can impose admission, sanctions on admission, then there's got to be a greater working together between the regulator and the commissioners to actually look at that. But I think what we don't do is perhaps reward good practice. I think the care home sector does feel targeted, and I think they have perhaps been vilified in the press, which I don't think is helpful, because then the public's perception is skewed about all homes provide poor care. So I think what we want is a commitment to say, well, all homes should provide, I don't think just minimum standards, but good standards, and how can we work to ensure that happens. So should agreed standards make it easy to check for compliance? And again, I have a worry that if we sort of think that we can actually just monitor quality by, either tick box or they've got that standard, but what about some of the, the relationships that are made between, the staff, the residents? How do we measure for that? And again, we've seen in other sectors that eroded in terms of like the health service, the nurse, had the time to spend with the patient, but often that was not seen as important. When we go to the doctor and you're told, well, you've got 10 minutes, if you've got 2 ailments, can you come back because you've only got 10 minutes? And I think we've got to rethink this, that we try and standardise everything and put time alongside, but it does take more time to have the sort of genuine, these relationships that we're wanting to happen in a care home. But all these pressures and demands that we apply, particularly to the care home sector, that they've only got so much time to give, and how can we help that? I've said a little bit about these self-monitoring reports, and again, some of you that fill those in, you might have a view about if you think they're useful or not, that in America, and I think, in England, we actually are following some of the sort of ways that are being implemented there, and they have what's called resident assessment instruments, and so they've got administrators that are just filling in these lists of pressure sores and continence, and they're saying that it gets in the way, and as I said earlier, that it can be false reporting. But if we rely on an instrument, it's not going to be perhaps an accurate picture of actually what's going on. So in our search, I think, for trying to standardise and to measure in a scientific, rational way, we are losing some of the very ingredients really that we need to be assessing and looking at and supporting and helping to flourish. And I think just lastly then, can we perhaps develop new ways and opportunities for everyone visiting the home, whether it's sort of friends, whether it's relatives, residents, to look at ways of providing feedback? So is it at an individual basis or as a group? And I think why I'm in favour of groups is that at least it's a collective response, that people can feel still quite frightened to be critical about the care that's being provided. So how can we sort of, engender opportunities for people to speak out? And so hopefully managers are not going to think, oh, I'm going to get all these criticisms, but that you might have tackled that to think, well, how can you work with the positives and then look at making changes and recognising, homeowners are going to get some things wrong, but if there's a willingness to change and to take action and address, things that perhaps they weren't aware of, then I think that's a healthy way forward. Okay. So I've finished all of I wanted to say now. So I don't know if people would like to have any questions of what I've said, or challenge anything that I've said, or clarify any points.
Well, we maybe start by thanking Sheila for her.
Was brought brought to you by Trinity College Dublin. For further information, please visit our website itunes.tcd.ie.